Welcome to Balanced Beauty Talks, the podcast where we redefine skin health through a holistic lens.
I'm Natasha, an esthetician and nutritional practitioner passionate about helping you nourish your skin from the inside out.
I'm Dr. Khadijah, an esthetician and naturopathic doctor here to explore the natural pathways to radiant skin.
And I'm Alicia, an esthetician and skincare enthusiast. Together, we're diving deep into the world of aesthetics, merging modern treatments with internal wellness so you can achieve long-lasting results without compromising your health.
Whether you're a seasoned professional looking to elevate your practice or someone seeking effective solutions for conditions like acne, you're in the right place.
Join us as we share expert insights, inspiring stories, and practical tips that empower you to embrace a truly balanced approach to beauty.
So get cozy and prepare to transform the way you think about skincare.
Welcome to Balanced Beauty Talks.
Please note that the information provided in this podcast is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Your health and well-being are important, and we encourage you to make informed decisions.
Welcome back to Balanced Beauty Talks. Today we're going to continue our injection series with a special guest, Mel. Mel is an injector here at Natology. She has her own practice primarily, but we are so fortunate to have her here one day a week. We get a lot of questions about dermal fillers, especially in the last year or two. I feel like it's a very talked about topic with social media and TikTok. So we're going to speak a little further on that today, answer all of your questions. And well, thank you, Mel, for coming.
Hello. Thank you for having me.
Tell us a little bit about you and your background and how did you end up here in aesthetics?
Wow. Oh my gosh, guys, I'm nervous. I've never been on a podcast before. This is so cool. Okay. So my name's Mel. I'm a registered nurse. I graduated in 2010. And I've kind of done a lot with nursing. Initially in like my undergrad, I worked in long-term care. Then I spent a couple of years on like a general medicine stroke unit. And then from there, the majority of my career has been in emergency medicine. And when I moved to Calgary, though, I was like, you know what? There's so many other areas of nursing that I don't have to work in the hospital. So I kind of dabbled outside of there. I did a little bit at a fertility clinic for a bit. And I worked at a plastic surgery center as well.
Oh, I didn't.
So yeah, I know. And that was kind of like my first introduction into aesthetics, and that was 8 years ago, 10 years ago. So it was a long time ago. But yeah, I ended up working there for a little bit, loved it, but got a full-time gig at Emerge and had to leave that one behind and go towards a full-time. But after that, I just still thought about aesthetics the whole time that I was in Emerge. Like I love Emerge, but it was just always drawing me there. It took me 7 years to finally like take the plunge and then finally take my course and get into aesthetics. But yeah, I did and I love it. And I'm mad it took me so long, but I finally made it here and I love it. It's like, it blends everything that I love about nursing. It's like, you get to help your people, you're building trust. You're making someone's day better, but it's in a way that's creative and confidence building too. So there's just something so rewarding about someone leaving, feeling more like themselves. And honestly, it gives me a rush every single time somebody is just like so excited about the results. I love it.
Totally.
Yeah.
A very, very different environment from where
Very,
you're
very different. Love them both in different ways. But
Yeah.
now aesthetics is my home.
Yeah.
Cool.
Yeah.
Amazing.
Mm-hmm.
What would you say was your very first injectable treatment, either received or performed?
Well, they were both Botox.
Okay.
So it's funny. So when I worked at the plastic surgery clinic, I obviously got my Botox treatment there. And I was very young for starting Botox, I think. I was 26 or 25.
Mm-hmm.
But I was like, I am such an expressive person with my face. I started getting deep lines like pretty early on, I feel. And I still remember my grade 9 teacher would say, don't do that with your face because it's going to stay like that. And I still think about it to this day and laugh about it because I'm like, well, now look what I do for a living. So my first treatment was Botox. I still remember like kicking in the whole thing. And it was just like so cool to me. I was just like, oh my God, I was fascinated by it. It's like, I want to do this. I love this. And then, yeah, my first treatment that I ever did was also Botox. So there we go.
That's where it started.
That's where it
All
started.
right.
It starts with the Botox.
I feel like that's the like entry
like,
level
yeah.
for most people.
Yeah.
You dip their
Like a nice
toes
way
in
to
with that a
start.
bit.
Oh, yeah.
Yeah. That or like a mini lip filler.
Yeah.
Totally.
Yeah.
What do you love most about treating people in aesthetics?
So I love seeing the shift in how someone feels about themselves. It's not just about the filler. It's not just about the Botox. It's like that moment when they look in the mirror and they just feel more confident. And sometimes it's really subtle. It's something that's softening their eyes or balancing their lips, but it has such an impact on how they carry themselves and helping people feel comfortable and confident in their own skin. It's just like the most rewarding part, and it just never gets old.
Yeah,
Yeah.
it really is.
Yeah, for sure.
That's what fills our cup too.
Yeah. Okay, let's dive into some of the details a little bit. What is the difference between filler and neuromodulators? Since I think a lot of people get the two of those mixed up.
Yeah, they do. It's a really common question. I think the first thing to say about it, though, is not a lot of people know what neuromodulators is, right? Like everybody knows what Botox is, but not everybody knows what neuromodulators are. Not a lot of people know what Dysport is, but Botox and Dysport, they're both neuromodulators and they work by relaxing the muscles that cause the wrinkles. So your frown lines, forehead lines, crow's feet, that's what a neuromodulator treats. Whereas filler, it acts differently. It's usually made of hyaluronic acid and it's used to restore volume, shape, and support in areas like lips, chin, cheeks. And the easiest way to think about it is neuromodulators smooth movement lines, and then filler adds and restores structure.
Yeah.
So they complement each other, but they both work really differently.
Yeah, I think people get very confused because sometimes they'll just be like, I need to get Botox in a certain area. And I'm like, I feel like maybe you mean filler, but you just don't know.
And like
What's the
all the
difference?
time, they're like, I got Botox in my lips. I'm like, did you?
It's like Kleenex.
Yeah,
You know?
exactly.
We're just Kleenex is actually tissue paper. Kleenex is the brand, and tissue paper is what it is.
Yeah.
And it's just the same.
Yes.
What are some like beginner level areas that you typically start filling people?
Yeah. So I'd say the best starting point with filler is an area that's going to give you the most natural return for your confidence. But for a lot of people, it's the lips. Sometimes just a half syringe to softly balance shape or add back hydration. Another beginner friendly area that a lot of people go towards is the cheeks because a little support there can really refresh the whole face without looking done. But honestly, filler doesn't always mean adding a lot. It can be just about subtle balancing too. And filler shouldn't always be added just for the sake of adding filler.
Yeah.
It has to make sense for your features and it has to bring harmony to the face. So if you're nervous, start small and you don't have to do everything at once. Your injector should walk you through it so it feels collaborative, not overwhelming. And sometimes the smallest changes can make the most intentional impact.
Yeah. So I feel like a lot of people, you probably hear this a lot, people wanting to have a natural look. So what does having the natural look mean to you in terms of filler?
So when I say natural looking filler, I mean results that blend seamlessly with somebody's own features. And it's not about changing how they look. It's about restoring balance or hydration and subtle structure. So you just look like a fresher version of yourself. The goal is that people notice you look great, but they don't know what it is. They can't pinpoint that.
Yeah.
So for me, natural filler, it respects proportions and it works with your face and it's not against it.
Not coming out looking like a different person.
Yeah,
Exactly. That's what I love about this whole like facial balancing. I don't even want to call it a trend because I think it's the right direction.
Yes, 100%.
Yeah, we kind of that got missed at the beginning, and now that's a lot more of a focus, and people are looking far more natural. And unfortunately, the beginning stages of dermal filler becoming really popular was those who were overdone and not in balance.
Yeah.
And so immediately the perception of a lot of men, especially who aren't aware, they think, don't you dare get filler. I saw a girl on the street, But there's a huge part of the population that's still walking around with filler that you would never know because you're just restoring and balancing.
And a lot of husbands don't know that their wives have filler.
Yeah. And that's why it's important to pick a good injector.
So your husband doesn't find out.
Gotcha. Tricked you.
We got a lot of women paying with cash for a reason around here.
Mhm.
Oh my God.
So funny.
Okay, so what kind of filler results do clients notice right away versus filler results over time?
So I guess there's biostimulators that aren't filler, but we can talk about that after. That's more of a
Mhm.
gradual progression. With filler, though, I say it's kind of a roller coaster. I always warn people that, especially with lips, it can be a little bit of a roller coaster. Initially, you're going to be a little bit more swollen than your end result. And
Mhm.
so it's always good if you're starting out with filler to start small too, so that it's not that shock factor of what
Mhm.
have I done?
Yeah.
Mhm.
So you're usually a little swollen afterwards. You're going to have a little bit of bruising. Sometimes it's not symmetrical. It feels a little lumpy, uh, but that settles. And so it usually takes about a week till it starts fully settling, 2 to 4 weeks until it's fully settled into your system. And at that point in time, everything starts to feel smoother. It feels more natural, and it just starts to feel like it's cohesive with your face, and it just feels much better.
Yeah.
The first is a roller coaster. I warn everybody, especially if it's your first time, because it is different,
Yeah.
But yeah, some people love that and they want more. And they're
Yeah.
like, oh, I actually like that swell. So they'll come back for a little bit more. But, immediately the nice thing about filler is that you do get an instant result, but it does change. It's not going to be exactly like that when you walk out the door versus 2, 4 weeks later.
Right.
It'll look a lot more natural and settled after that.
Is filler always about volume, or are there other reasons why you'd use it?
So people always think filler is about making things bigger, bigger lips, bigger cheeks, but it's actually not the case all the time. A lot of the time I'm using tiny amounts to smooth or soften shadows or to create balance. For example, in the under eyes, it can take away that tired look. In the chin, it can make, the whole face look more proportionate. And sometimes, a tenth of a syringe in the right spot can make such an impact versus a full syringe in the wrong area. So for me, it's not about volume, it's about harmony, and it's about helping someone look like themselves on their best day.
I love that.
It sounds like
Mhm.
it's very much an art, like to be able to
Yeah.
see and like tweak things in like the perfect
Mhm.
way.
Yeah. On paper, it seems simple,
Yeah.
but it's
It's
not.
uh,
It's not. It is an art,
yeah.
which is fun. It's like a creative outlet
Yeah.
too.
Yeah.
Yeah.
I can see that.
Yeah.
So there's a lot of people that I think, just kind of going back to what I said before, they're afraid to start fillers because they have a perception that it looks fake or imbalanced. How do you deal with those clients who are really scared about looking overdone?
Yeah. It's a valid concern. And honestly, I hear it all the time. All the time.
Mhm.
And I think it's because of social media
Yeah.
and, TikTok, and look at this person that had all of this filler. And there's always just those like terrifying photos on there. But that's not how it should be, obviously. And so my approach is always conservative, collaborative, and we always start small and then make the treatment feel like it's aligned with your goals and then build gradually if we need. So I focus on the balance, proportion, and like not chasing the trends. So the results, they look like you, just like a little more refreshed. And I'd much rather have a client coming back saying they want a little bit more than feeling like they left having too much done.
What would you do if someone came in and they had a photo of a celebrity and like a really unrealistic expectation?
Yeah. Happens. It does. But yeah, those ones are tricky because they want this result, but that's a different face than yours,
Yeah.
So everybody has their own anatomy, and you work with what you have. And we're not trying to make you somebody else. We're trying to make you look like your best version of yourself.
Yeah.
So you really have to reel things back, talk about their anatomy versus their anatomy. And, maybe that looks great on them, but maybe it won't look great on you. Or maybe it's something that could actually never be achieved for that person. So you have to really set those realistic expectations for a person. Yeah, those are kind of tricky. They're usually a little disappointed, but I think once you start to bring them back down to earth a little bit,
Yeah.
they feel a little bit better about it. And they're usually very happy with the results with it. So
Yeah.
yeah,
Okay.
those ones are tricky.
So why don't we switch over to Sculptra, which is something
Mhm.
that we recently brought into Natology. So could you talk a little bit about what Sculptra is and what makes it different from traditional filler?
Yeah, so it's really different from traditional filler because it's not a filler, it's a biostimulator. So traditional fillers are usually hyaluronic acid based, and they give instant volume by physically filling the space. Whereas Sculptra, it works differently. Its active ingredient is called PLLA, or polyl-lactic acid, and it's a substance that stimulates your body to produce its own collagen. So instead of adding volume, it's a gradual rebuild of your skin's foundation over time. So the results come on really, really slow, and you look natural because of it, because it's your own collagen doing the work. And that's why it lasts much longer than filler too. So yeah, she's a beautiful thing,
Mhm.
Sculptra, the way of the future.
Yeah,
Yeah.
I think a lot of people
Mhm.
are going in that
Yeah.
direction over filler, depending on the concern, of course. But
Totally. Yeah,
yeah,
exactly.
which brings me to the next question. Who is a great candidate for Sculptra, and how does that treatment plan look in comparison to filler?
Yeah. So a great candidate for sculpture would be somebody who's starting to notice an overall loss of support in their face, some hollowness in the temples, the cheeks, the areas that you can fill with filler, but it's gradual over time. So somebody that's looking for like a very natural result is a really good candidate for it, or somebody that's looking for more of a long term gain as opposed to an instant fix with filler. The results last quite a bit longer than filler, too. So that's really nice about it. So with filler, you get your result instantly, whereas Sculptra, you're usually coming back for a few sessions every, 4 to 6 weeks for 2 to 3 treatments or so. And then that result builds on top of one another as it's building your own collagen production up. And then the results from that last about 25 plus months. And so, yeah, it's really great for the long term gain.
Amazing.
Yeah, more of an investment in your skin's long term versus an instant fix. Yeah.
Hmm.
Mhm.
What do you feel like clients love the most about Sculptra once they've had it?
Yeah, so clients love that Sculptra. It just feels so natural.
Mm.
It is your own collagen. So they feel like their skin looks firmer and their face looks fresher, and that no one can really tell they've had anything done. They just look refreshed. And so it's kind of those, quiet kind of confidence, the subtle changes that just make you feel so good. And because the results build gradually, it doesn't feel like a big sudden change. It just feels like you've aged backwards a little bit.
Nice.
Mhm.
Yeah.
Who doesn't want that?
Yeah. We're turning back the hands of time
Love
with
that.
it.
Amazing. Would you ever mix Sculptra with any other treatments like laser or microneedling or
Yes,
anything? Yeah.
absolutely. So sculpture is amazing on its own, but it pairs really, really well with other treatments. All treatments are great with a combination treatment. You
Mhm.
get the best results that way, but it works by building your own collagen and strengthening the skin over time. So if you want to combine it with filler in areas where you want a more immediate shape and hydration, or pairing it with treatments like microneedling or laser, that can actually complement the collagen stimulation. So it's never a one size fits all. It's about making sense of your goals for your treatment. But
Mhm.
heck yeah.
Yeah.
Oh, yeah.
Let's switch into people who are new to injectables. What should somebody actually expect after their first injectable appointment in terms of swelling, bruising, pain?
So most people are pretty surprised by how quick and comfortable the whole process is. I mean, you might have some swelling and a little redness and some small bruises in some areas, but it's all normal and it's all temporary. And so, like I said, with the lips, for example, they can be a little bit swollen afterwards for a few days, but that settles. Areas like the cheeks, the chin, they tend to settle a little bit more quietly. Tenderness is common, but it's usually very manageable, and most people are back to their normal routines right away. So, key thing I tell people is that day one is not the final result.
Yep.
So, it takes a
Mhm.
week or two for everything to settle and for it to all look its best.
Mhm. Yeah.
What would you say are your top three pieces of advice for people who are new to injections?
My top three pieces of advice. So, first and most importantly, I would say do your research on who you're trusting with your face.
Mhm.
Every injector has a different style. Some lean more into the really noticeable changes. Others are more conservative. So, go to their Instagram, look at the before and afters, ask questions, go for a consult to make sure your philosophies line up with what you're hoping for. And then second, I would say I always recommend starting small. So you don't need to have a big transformation after your first appointment. Sometimes half syringe in the lips or like a little support in the cheeks can just give you that confidence boost without feeling overwhelming. You can always build on it later if you want, but I find most people are surprised by how much of a difference like a small strategic little tweak can be.
For sure.
And then number 3, I'd say, patient with your process. The day you leave your appointment is not the finished result. There can be swelling, there can be bruising, and sometimes things don't look perfect right away. And that's all part of the healing. So give it a couple weeks to fully settle before judging the result. And I always tell my clients to think long-term injectables work best when they're part of a gradual, consistent approach over time rather than expecting everything to happen all at once.
Yeah. Yeah, I think that's a big misconception is people think it's a one and done kind of thing, but it is actually a long-term journey and a process to get the result that you want.
Exactly.
So this is something actually I feel like is on social media a lot, and we'd love to get your take on it. Is it true that filler never fully leaves the body?
Yes, that is on social media these days. So it's a really common myth. The truth is hyaluronic acid fillers, the most common type, they're designed to gradually break down and metabolize your body over time. So how long they last depends on the filler that you're using in the treatment area you're treating. So the lips, they last about 6 to 12 months. If you're doing your chin, you're using a firmer product, it lasts, 12, 18 months. But they're all being metabolized by your body over time. Where the confusion lies, though, is that they're learning about how there's trace amounts of filler that can linger in tissue for longer than we once thought. So there's tiny little microparticles that they've seen on MRIs that have been there 16 years later, but they're nothing that's actually visible on the surface. They're just super tiny little microscopic traces of the filler. Yeah, it's not harmful though. You're not carrying around permanent filler unless you've chosen a permanent product, which isn't typically used in modern aesthetics.
Yeah.
Okay, so back to facial balancing. What's your take on it?
I love it. It's one of my favorite approaches. So because it looks at the face as a whole rather than just, chasing one feature at a time. Instead of, just filling the lips or the cheeks in isolation, we're looking at the overall features together. So it's, proportions, harmony, balance, everything that I love. And sometimes the best way to make, your lips look great is by actually supporting the chin or the cheeks and not just putting more in the lips. So it's about creating symmetry and flow. And so the end result, it looks really natural and cohesive and not injected. Yeah.
Beautiful.
Sometimes there'll be people that come in and, they want their lips done, but what we should talk about is maybe your chin. Because if they have a really recessed chin and you're wanting to add more volume to those lips, it's actually going to make your chin look more recessed and it'll make your lips, stand out in a way you don't want them to. And it's something people don't notice sometimes when they come in. They think they want something. And, we start talking about other, areas of the face and how that could balance it out. And in the end, they're like, yeah, you're right. Obsessed.
Yeah.
Makes a big difference.
Yeah.
Yeah, I've seen that a lot now with lips. It's usually a lip and chin combo.
Yeah.
I love a lip and chin.
Yeah.
Love a lip and chin. So satisfying.
I think that's because people are out thinking about like symmetry or what you're seeing. Like they don't have that in their mind. So that's why it helps when you can point it out and then they do get the result they want. It wasn't what they originally thought it would be.
Exactly. Yeah, exactly.
Have you ever had to turn people away when they come for injectables or recommend that they wait?
Yes. Okay, so I have a funny story about this. So I had a girl come in, a client, a few months ago, and I recognized her name. And I was like, okay, I know her name. She wasn't in my database or anything. And then she came in and I was like, okay, I know your name. I know your face. Like, where do I know you from? And she had seen me years previously at the place that I was at before. She's like, oh yeah, I came to you years ago and I wanted Botox, but you told me I didn't need any. And so I didn't get a treatment done that day. He wouldn't do it for me. And then she came back like years later, found me at my new place, and then came for a different treatment. And so, yeah, I just thought that was like a really important thing to think about as an injector for, other injectors out there. Like, say no, because they will trust you after that. They know that you have their best interest in mind. And yeah, years later, they'll find you down the road for something else.
Yeah.
So yeah, I had a good chuckle about that one.
Yeah.
And I mean, I guess on top of that, I do not like filling over a migrated lip. It never looks good. So there will be people that come in and, they've had their lips filled somewhere else. They're coming in to try a new place and they've got so much migration, but they think they need more filler. And sometimes they're disappointed. They don't want to, get it dissolved. But when they do, they're like, you were right.
Yeah.
Yeah. So it's a tough pill to swallow for some people.
For sure.
But once they do finally do that, if it's needed, yeah, they're happy. They're happy. Mm-hmm.
Let's talk a little bit about your approach. I want to know, how do you make sure your clients leave feeling like themselves and happy?
Well, that's always my number one priority. So my goal isn't to change how somebody looks. It's to highlight what you already have there. I spend a lot of time in the consult asking what people actually like about their face, not just what they want to fix. And so then I take a conservative step-by-step approach and start small, focusing on balance and proportion and making sure that nothing feels overdone. I'd rather a client leave wishing that we'd add a little bit more than walking out feeling like they don't recognize themselves. Yeah. So results, when they blend seamlessly, it just feels like them and they just have so much more confidence. Yeah.
It's so beautiful to see the change.
Yeah.
Confidence.
Best.
Yeah.
It's the best. Yeah. It's like a high.
It
for
is.
us, right? It's the best.
Yeah. What's your personal philosophy on facial aging and enhancements?
Yeah. So my personal philosophy on aging enhancements is that it's not something that we have to fight against. It's a natural process. And what I focus on is helping people move through it in a way that still feels like them. So to me, it's less about chasing youth and more about preserving the balance, the structure, and the skin health over time. Those subtle, small changes can be softening things that bother us a little bit, or, a little volume loss, adding a bit here without erasing the character and the uniqueness of someone's face. So yeah, aesthetics is, it's a tool for confidence. It's not perfection.
Yeah,
Yes.
totally.
Yeah.
Yeah, we need to get out of the perfection mentality. Filters have really ruined it.
Oh,
They
yeah.
really have. Yeah.
I think we're finally, though, starting to
I
see a
feel
shift.
like even just in general with aging and the way people are looking at it, I feel like there's a shift happening there too.
Oh, for sure.
Yeah.
Yeah. People are like, I want to age gracefully.
Yeah.
Like, heck yeah, you
Yeah.
do.
It's like
Let's do it.
We're not going to either extreme. We're kind of like
Yeah.
finding something in the middle.
100%.
Yeah, absolutely. Do you have a favorite treatment or a favorite combo that really gives like the wow factor transformation?
I got a lot that I love, but I mean, combo treatments, they always give the best results, pairing cheek filler with a little under eye support. It just like instantly gives that whole mid face a refresh, and it takes away that tired look without anybody knowing why you look so good. And I mean, I do love a chin and lip. I just love that. It just gives this beautiful harmony and proportion to the face that just like, I don't know, I got a soft spot for the chin and lips. But yeah, there's so many beautiful ones too. Filler and Sculptra. It's also another beautiful combination treatment. So yeah.
What about like filler and neuromodulators?
Well, yeah.
What's your favorite area to combine there?
My favorite for filler and neuromodulators?
Like a lip?
Well, I mean, lower face for sure. Yeah, a nice little Nefertiti lift. You do the DAOs where it's the DAOs are the muscle that pull the corner of your mouth down. And so if you inject that area, you're reducing the risk of jowling from occurring over time. So you do that. And if somebody also has like a little recessed chin, you add that. And it just makes the jawline look so good. It's beautiful.
What's one trend in aesthetics that you're so over, and what's one that you're loving?
I mean, obviously, it's the overfilled look. It's done. It's been It's had its moment. Well, I don't know why it had its moment, but it did. But, those lips and cheeks, they were so exaggerated and they took away from everybody's natural beauty. So I think the majority of people want the opposite of that now. So I'm obviously loving the trend towards more subtle individualized treatments, things like facial balancing, collagen stimulating with Sculptra. It's less about chasing that single feature and more about creating the harmony, long-term skin health, and it just feels more timeless.
So this is our last question. What do you wish everyone understood about aging and beauty?
I wish everybody understood that aging is not the enemy. Okay. It is a gift and we all go through it and it doesn't take away from any of our beauty. What really makes somebody beautiful is confidence and authenticity, and treatments are just tools to support that. So when we shift that focus from trying to look 20 forever to instead feeling like the best version of ourselves at every stage, the whole experience of aesthetics just becomes so much more positive and so much more empowering.
Love that.
Okay, well, that's it for this episode. Thank you so much for joining us, Mel. We'll put her information in the show notes so that you can find Mel anywhere on social media. Don't forget to like, follow, share, subscribe, all the things. And if you have any topics that you'd like us to cover in the future, please put them in the comments or send us an email. And thanks for listening.
See you next time.
Bye, guys.